Hello, everyone, and thank you so much for joining us. My name is Lindsay Singler, and I'll be moderating today's session. Welcome to our first Heal Connections sharing session. As everyone's saying hello and telling us more about yourself in the chat, we'll get started today with an overview of our new Heal Connections Center from one of our principal investigators, Dr. Christoph Hornick. We'll then move into our featured presentation on research dissemination strategies from the Justice Community Opioid Innovation Network, JCOIN, followed by an interactive Q&A. At the end of today's meeting, we'll share details about our next sharing session and a meeting evaluation so that you can help us co-design these sessions to be valuable and useful to you. So without further delay, I'd like to introduce my colleague, Dr. Christoph Hornick. Christoph, over to you.
Thank you, Lindsay. Good afternoon or good morning, everybody. My name is Christoph Hornick. I'm a principal investigator of Heal Connections alongside my faculty partner, Faye Taxman, who you'll hear from in just a couple of minutes, and several of our colleagues. Many of us on the call today undertake opioid research with different perspective and different focus areas. Mine is coming at this from the question of how to evaluate pain treatments for children. But I think like many of us, I'm looking for ways that my research results benefit more people. And that's why Heal Connections was created. Heal Connections is a new center funded by the NIH HEAL initiative to help accelerate HEAL research into action. And our mission is broadly two-pronged. First, to create pathways to further build and sustain researcher community partnerships. And two, to support HEAL researchers to meaningfully share their research results. HEAL Connections was created to enable HEAL's vision, which is to make research results useful for communities. But to do that, I think we first agree that we first need to understand what the community needs. Next, build bi-directional partnerships between researchers and those communities. And then finally, make our research results somehow understandable, accessible, so to speak, user-friendly for our communities. To help with this, Heal Connections is actively building and extending HEAL relationships in 6 core areas of focus. These include community-based organizations, health, patients, priority populations, state, tribal, local, and federal governments, and the criminal justice system. Our framework for community engagement is really building off of existing successful models from across HEAL, such as the one presented today by the Justice Community Opioid Innovation Network, or JCOIN. Our framework is intended to foster bi-directional partnerships between HEAL research teams and intended beneficiaries and stakeholder groups to help broaden the reach and impact of HEAL research results. Our services extend from this community partnership building and from representative stakeholder feedback loops, seen here in purple, to dissemination support services, where we help select research teams to develop communication products to share their research findings, in red here on the slide, and then on to training, office hours, resource sharing opportunities to build research team capacity to disseminate. Altogether, these Heal Connection services support our center's objective to create pathways to further build and sustain our community partnerships and to support HEAL researchers to meaningfully share their research results. Concretely, HEAL Connections will be offering 1-hour consultation sessions to all HEAL projects as you plan for and are near results dissemination. These consultations are focused. They're timed to talk through the dissemination challenges and opportunities specific to your research with our in-house team of experts. You will leave these sessions with guidance and strategy considerations to help you expand the impact of your work. We will also provide select HEAL projects with deeper knowledge translation, dissemination, and implementation support, as well as content development services to help extend the reach of the research findings into communities. Our center will be assessing HEAL projects for support based on the science, the potential impact, and the readiness for dissemination implementation of the work. Importantly, we know that many of you already have very strong community partnerships and dissemination plans in place. And we really want to learn from you and spotlight your work on sharing sessions like today's. We'd also want to extend your efforts to our network of community partners. So to get in touch with us, to set up these consultations, simply send us an email, and thus contact information will be in the slide deck and in the chat. Because we know that our center cannot scale to provide hands-on dissemination support to 1,000+ HEAL research projects, we're introducing several complementary services designed to build research team capacity for dissemination. This starts with the Heal Connection sharing sessions. The first one is right now, which are basically peer-to-peer training sessions on research dissemination best practices. If you have a topic, if you have expertise, if you have a case study you'd like to share with your HEAL ecosystem colleagues, please complete the meeting evaluation survey, which will be in the chat today, to alert us so we can find ways to connect with you and spotlight your work. After each sharing session, we'll offer office hours, and those are designed to be a deeper exploration of the training topic of the sharing session between our in-house team and several other HEAL project research teams, so that we can learn from each other, support one another in these efforts. And then finally, after each sharing sessions, we will be sending out a curated set of resources to assist HEAL project with result dissemination as it pertains to this sharing session. So we hope that this brief overview gives you an idea of what our center is about, and that our center services are going to be helpful to you as your project plans for result dissemination. Without further delay, I'd like to hand over back to Lindsay to introduce our first sharing session case study, which is going to spotlight the outstanding dissemination work coming out of JCOIN. Lindsay, back to you.
Thanks, Christoph. Today's case study from JCOIN will be presented by Tisha Wiley of the National Institute on Drug Abuse, Faye Taxman, the principal investigator of JCOIN, and Jessica Holsey, the CEO and founder of Addiction Policy Forum. Tisha is the visionary behind JCOIN, and we'll learn from Tisha and her colleagues about how they've engaged health and justice practitioners and individuals with lived experience to broaden the reach and impact of JCOIN's research. Tisha, thank you so much for sharing your experience with us, and over to you.
Thank you so much, and thank you for inviting me here to share with you what we've done with JCOIN. I'm just going to preview by saying I'm going to talk about how we designed JCOIN to function as an overall network, but I'm really excited to have Jess and Faye here to give you a deeper dive in the specifics of the work they're doing through our Coordination and Translation Center. Before I do that, though, I just want to back up and share with you why it's so important to focus on the justice system as part of any effort to address the overdose crisis. In the United States, most drugs, including opioids such as heroin or fentanyl, are illegal to use, and in turn, using those drugs brings people into contact with the justice system. And what it translates to is that people with substance use disorder end up disproportionately represented in the U.S. justice system. In jails where stays are relatively short, 63% of people who serve sentences have a substance use disorder, and that proportion is quite similar in prisons where people serve longer sentences. If you look at this chart on this slide, this was created by the Prison Policy Initiative using data from SAMHSA, and really what it shows that people who are coming into contact with the criminal legal system have high needs and a range of challenges, but the more time someone is arrested, the more likely it is that they have a substance use disorder. And what happens in jails matters a lot, jails and prisons, because 95% of the people who pass through the criminal legal system are going to return to the community. And when they return to the community from stays in jails and prisons, they are at a particularly high, vulnerable time for a risk of relapse and of death. And so we know this is a very vulnerable time, but we've also learned from research that we've funded in the last few years that providing medications for opioid use disorder during people's stays in jails and during this transition time can cut mortality risk quite dramatically. And one of the cornerstones of our approach in JCOIN, as I'm going to show you in just a minute, is the idea it's not enough to just bring the justice system to the table. A meaningful response to these challenges that face this population that are passing through the criminal legal system requires engagement from both the justice side of the system as well as the community treatment system. And this slide here really illustrates why that's the case. Even when people are in the community, when people are referred to treatment systems from the justice system, only 5% receive access to methadone and buprenorphine, compared to 40% of people who engage with that system without that justice referral. So we see these disparities, even though we know that these medications are life-saving for this population in this particularly vulnerable period of time. And so that's the backdrop and the vision for why we created JCOIN, why it was a huge initiative as part of this first set of initiatives that were funded in HEAL, but also the why of how we designed it. And really the cornerstone of our approach is really this intersection of researchers, community partners, and justice partners. And I don't have it labeled here, but at the center of that Venn diagram is really the people who we are trying to help with the work that we are doing. So we launched JCOIN in 2019. We expect it to continue to be active through 2025. I'm going to talk you through sort of how we designed it, why we designed it the way we did, and how all the work fits together. This is our vision statement that we use to organize all of our work in JCOIN. And the vision statement is that every person who's involved in the justice system that has a substance use disorder should have access to effective treatment. And that is something that is true whether that person is detained in a prison or jail, or if they're being served in the community. This vision statement was my North Star, and these priority goals were really what guided the way that we designed the network and the structure of the network as we did it. But I will say, even though this mission statement was something that was sort of the impetus for how we put JCOIN together, once we made the awards and launched the network, we put this vision statement in front of the whole network at our very first meeting together, and asked our entire network to participate in refining that vision. So the version you see here is actually reflecting that process of gaining buy-in and making sure that as a network, everyone was on the same page about this vision as a North Star, and these priority goals is the way we were seeking to achieve that. And I want to acknowledge that this vision statement is not a 5-year goal. It is something that requires system change at multiple levels. It goes well beyond what NIDA as a research agency can do on our own, but it gives us sort of a vision for where we'd like to see the world move. And these priority goals are sort of how we hope to get there. I'm going to avoid showing you an org chart of JCOIN. Instead, I'm going to show you all the different activities that our network engages in and how we're using that to push toward these priority goals. But I will say, just so you understand the structure, JCOIN consists of 13 research hubs, each of which is executing a large-scale clinical trial. We also have a Methodology and Advanced Analytics Center, or our MARC, which centralizes data across the study, supports a data commons, and also conducts novel research, including modeling studies and surveys. And then you'll hear from our Coordination and Translation Center, and they provide our overall coordination and many other supports, including communication and dissemination support. We call this our honeycomb slide. It shows you this vision and structure, and actually those goals mapped onto all of the different activities that happen within our network. And I know it's a lot to take in, so I'm just going to break this down goal by goal and show you some of the things we're doing and the lessons learned that we've learned so far from these approaches. First and foremost, our goal is about research. We're NIH, so we want to generate evidence about what works and how to effectively implement those things that work. I will say on this slide here, I said we have 65 total research projects to date. Learn today, we are actually at 72. And in part, that's because we've taken this flexible approach to the way we design the network. There's research happening everywhere within the network. Our 13 multi-site clinical trials are run by our research hubs, but our Coordination and Translation Center and our Methodology and Advanced Analytics Center also do complementary research. And actually in 2018, we awarded a number of what we called accelerator supplements, which were small grants that were designed to address high priority short-term research questions so that we could learn something, so we weren't waiting 5 or 6 years for these clinical trials to complete before we started learning things that could move the field. Of course, so those clinical trials are things that we hope are going to provide rigorous evidence, very strong evidence through these large-scale multi-site clinical trials. But other research efforts we have include policy scans and surveys and modeling projects, methodology projects, harmonized measures across all of those multi-site clinical trials. Those are all complementary. They wrap around those clinical trials and also help us understand the context that all of this work is happening in. And then one of the approaches in the way we designed the network was really to build flexibility to respond as the field evolved. One thing we've been particularly proud of is a small grant program that we call our Rapid Innovation Grants, or JRIG, JCOIN Rapid Innovation Grants. And this has been something run through our Coordination Center that's offered an opportunity for folks in the field that may not be able to compete for traditional NIH grants or have ideas that are earlier stage, to come in with their great ideas and get some early stage funding to help do that. With that approach, we've funded folks that are coming from organizations that don't have a long track record of NIH funding, from practitioners out in the field that have great ideas, and from earlier stage investigators. We've also supported a number of diversity supplements and other administrative supplements to build that flexibility, so we're always generating evidence that's responsive as the field evolves. I'm not going to go into a lot of detail about our specific projects, But want to give you just this general framework. We do have a special issue of the Journal of Substance Abuse Treatment, where all of our clinical trial protocols have been published. But sort of at a big picture, our studies are looking at 2 are looking at state policy rollouts. We've got 7 that are looking at different linkage interventions. 2 are looking at the different long-acting FDA approved medication, long-acting medications in comparison to all the medications in comparison to each other. And what we hope when you put all this together is that we are going to help sort of advance the field in terms of knowing how to roll out these interventions and what looks like it's going to work. I also just want to mention we have these multi-site clinical trials because we wanted to create a national footprint. And through these clinical trials, we've reached 28 states and 125 counties. But if you include all of those JCOIN studies I showed you on the previous slide, we're working in 38 states and Puerto Rico and 141 counties. So our next goal was really about developing this collaborative network between researchers and practitioners, collaborating across both justice and community-based service settings. And so it's really sort of cross-sector work requires cross-sector engagement. I think I have been involved in a lot of justice work in the past, and one mistake I know I've made in the past in thinking about networks is focusing only on one side of the equation. So bringing only the justice partners to the table. But if we're going to focus on people, how people move across the system, we've got to bring everyone to the same table and build those relationships. And that's something that we have to do at every level of the initiative. So we do that in terms of the way we structure our steering committee. But also at each of those sites, this is done at the local level, making sure you've got both the treatment and justice partners at the table at the local level. I mentioned earlier about how that's helped us build a national footprint. And then building this collaborative network is also about finding the common ground. So we've got a lot of work groups working on common areas, common measures. We've seen papers come out of this. We've seen a lot of really interesting, unexpected benefits. And one thing in JCOIN, we're very data driven. So we actually conduct a survey, a network survey to see, are we building relationships that didn't exist before? We have a paper that's under review right now that really does show using network analysis that this approach has helped us build a network of people working together who maybe hadn't worked together before. And engaging stakeholders means stakeholder engagement at multiple levels. And you'll hear from Jess and Faye about some of this work, about how we have a practitioner board and a stakeholder board and what that means. We work also colleague to colleague with our federal partners to try to make sure we're collaborating closely, that they know what we're doing, we know what we're doing, we're understanding how the field is evolving so that we can be nimble and evolve and respond to those evolutions over time. And I think you'll hear from Jess really about how important this engagement with our professional societies and how much of a useful tool that has been for us in the way that we've conducted the work in JCOIN. So our next goal was really about building capacity to conduct and apply research in justice settings. And one of the big picture issues here is really emphasizing that we have to address not only researchers' abilities to go into these settings and be sensitive to the complexities of the settings and work well with their partners, but also increase the capacity within the field to partner, to feel empowered to bring research questions up, to answer their own research questions and to do that. And so really, I think, again, I hope you'll hear a little bit more about the LEAP training program, which has been a program that has focused not just on training for investigators who are ready to launch into NIH-funded research careers, but also sort of folks at earlier stages and practitioners, sort of building capacity in the field, meeting people where they are, and connecting a lot of resources. And translating those resources out to be shared with others. So we develop a lot of different trainings. Those all get placed on an online training platform. But one other piece I want to just highlight in the way that we thought about building capacity, if you go back to 2019 and 2018 when we were funding JCOIN, NIH was not the only agency that had received a large number of funds to address the overdose crisis, and particularly relevant to the work that we do in JCOIN, the Bureau of Justice Assistance was funding a lot of work, and really trying to hold ourselves accountable to the same idea of these partnerships. We built relationships with our colleagues at BJA and talked about sort of the overlap between our shared mission and gaps in the field that we could work together to collaborate. And so BJA provided some funding for us to stand up a couple of different components meant to bridge the work that BJA does and that NIDA traditionally does. And so with that, we established a platform to connect researchers and practitioners called Connect. We also built an on-demand technical assistance center really to address research needs. So if you are a researcher working in a jail and you would like to evaluate your program, but you don't know what measure to select, you can go and get this on-demand technical assistance. We've had, I think, over 80 engagements at this point working with different communities, and those have gone from small, very directed efforts to very large scale ones, and ones that have then turned into new research questions, which really creates that bi-directional relationship that we're hoping to support within JCOIN. And of course, then we have to work on disseminating out what we're doing, creating that translation of science into solutions and creating feedback loops. So I talked a little bit about how we've seen some of those feedback loops emerge through our technical assistance program, but we also have data commons. We have a really wonderful, lots of different products and tools that have been developed, a newsletter and portal. And I know I'm running short on time, so I'm going to skip ahead and show you just a couple of examples of how this all comes to fruition. This just zooms back to the big picture, and we've got a lot of different metrics that we track about whether or not we're making progress on our intended goals. So actually it's 72 research protocols, more than 15,000 participants enrolled, great national footprint. We've got a podcast with over 8,000 subscribers, courses, webinars, trainees, but let me show you a couple of specifics. So I talked a little bit about how we were able to do these short-term studies back in 2018. So this is an outcome from one of our accelerator supplements that's really focused on public and system surveys. If you go and rewind back to 2018, one of the best sources of data, if you wanted to know how many jails were offering medications, it was actually a report from an investigative reporter that suggested fewer than 5% of jails we're offering these medications. And we really wanted to formalize this by collecting data in communities. We decided to target the communities that had the highest overdose rates. And what we found from that survey, which was executed in 2020 and 2021, which was a tough time to be collecting that data, but we found that the field was rapidly shifting. Now, 43% of jails that we surveyed reported that they were offering all three medications, but the devil is really in the details, because only 20% of those were offering to all three medications to anyone that was eligible. But more than that, what this study did is provides us a roadmap for where we need to go in terms of addressing best practices. There was some additional work too that helped us understand where the field saw the greatest needs and how we can be responsive to that. We also built into the structure of JCOIN a follow-up. So I just heard that we hit 100% of our targeted recruitment for the follow-up survey. So hopefully we'll be sharing data later this summer and fall about sort of where the world looks in 2022 to 2023. The research that we funded through the accelerator supplements is also painting a big picture of what we're learning about the field. So we know now not only do medications provided prior to release from jails reduce overdoses, our accelerator supplements showed an impact on reducing recidivism, as well as an impact on shifting costs away from emergency care, and highlighted the potential of extended release buprenorphine to increase adherence and reduce recidivism during that return to community period. And the partnerships that we've developed between our justice partners and our researchers has led to things like this MOUD cost estimation tool. It was recently published, and as a tool you can go and download if you are a jail thinking about what would it mean for me to offer these medications, how much it's going to cost, and which model should I do. This is a tool that came out of a collaboration between our economics team that was working across multiple research teams and our partners. And you see highlighted on that paper there the sheriff, the budget director for a jail, and a treatment director for a jail. And so really this close collaboration to generate tools that are useful to the field. And just one other thing, just hot off the presses last week, through our collaborations and talking to our federal partners, all that money that went out to the field in 2019 and 2020, we actually have a map where you can see across multiple agencies, where did that money go? How is it being used? And then this paper is a research effort to look at how that allocation matches where you saw needs in the field. I'm going to turn it over to Faye and Jess now to talk through their specific work, but I want to come back again to sort of a vision point. This is a a model in the field that's used quite frequently called the sequential intercept map, and sort of maps all the different places people touch the justice system. It's a very complex system, but I think where we need to go as we move forward is really the idea that you shouldn't have to go to jail to get treatment, but if you do, you should get access to evidence-based treatment. And sort of, again, that kind of further refines that North Star that's guiding the work that we're doing. And so I will, with pleasure, turn it over to Jess and Faye to talk about the specific work and all the amazing work they're doing through the Coordination and Translation Center.
Thank you, Tisha, for giving a great overview of both the vision of JCOIN, but also how we've been able to put in place the pieces to really advance the translation and uptake of science into practice. So I'm Faye Taxman. I am a part of the JCOIN Coordination and Translation Center. And on this map here, you can see my team that's working, we call it the CTC. So one of the things that we felt were really important if we were going to achieve the vision that was set out for JCOIN, which was really to make sure that people had opportunities to have effective treatment. We decided to assemble a team that was very robust, that included not only traditional academics like myself, but also included a number of people from different disciplines, social work, the medical field, criminology, health services. And so we included, from an academic perspective, this broad array, but then we also included partners like the Addiction Policy Forum, who you're going to hear from, Jessica Halsey, in a few minutes. And we also included tasks, both of which are large outreach into the field, because we felt that if we want to be effective, we can't just go on a very narrow path. And I'm telling you this only because most of us as scientists, we have developed relationships with our colleagues over the years. But I think to really be able to do effective dissemination and uptake of evidence-based practices or research findings into practice, you really have to have a team that speaks to all the different constituencies and stakeholders that exist. So this is our team. It's awesome. As Tisha described, we have a very broad role within this JCOIN. The CTC has 6 cores. But together, collectively, these 6 cores sort of had 4 main goals that we're trying to achieve. One is this concept of meaningful engagement and collaboration with a broad array of stakeholders that not only include the academic field, but also people in the justice and health and community-based organizations that are on the front line of delivering services that for people with substance use disorders in the criminal legal system. The second kind of goal that we set forth was to implement evidence-based practices to foster different types of implementation. And we did this in a way in which we want to really reduce the translational gap. So we have a broad array of products that include everything from journal articles, which are prized by the academic community, to a series of podcasts. And we've actually learned that those podcasts are actually extremely useful, not only to practitioners, but academics. And a lot of our colleagues are using them actually in the classroom to help train the next generation of students and practitioners and care providers that work with this particular population. So we're really focused on a variety of products that can really deal with the translational gap. The third part is that we really want to disseminate quite broadly to reduce this translational gap. And then the fourth part is to really expand our outreach in many different ways. And Jessica Halsey will talk about this in a few minutes, to build capacities, but also to open up avenues by which science can be embedded in practices. So collectively, the CTC takes on this very important role of which we support our colleagues that are doing the clinical trials, but we're also working deliberately on some of the issues related to dissemination and implementation, which of course is part of, as Christoph spoke about in the beginning, is part of the goal of HEAL Connections, but not just inside the JCOIN initiative, but across the spectrum of all the studies that HEAL has funded. What's our methodology? Well, our methodology really is borrowed from how do we extend our reach, how do we develop partnerships, and how do we message to particular different types of audiences. So, we use this as kind of a framing perspective that we need to be able to use various types of mediums to be able to get the message out about what we're learning in JCOINs, what are some of the mentor sites or, different organizations that have been able to do, in many cases, things that no one thought they could have done 5 years ago, 10 years ago, which is put in place MOUD in a jail setting, put in place transition of care from jails to the community using peer navigators. All of these are very important but complex ideas. And so we use a variety of mediums to be able to really help the field understand what is the findings, and then how do you go about implementing this in your different settings. And to a large extent, we focus much more of our attention on reach, as much audience as we can. And a lot of the work that our colleagues are doing in terms of, clinical trials and multi-site studies, in those situations, they focus much more in terms of, peer-reviewed articles, policy briefs, and some of the other mechanisms by which they can work with their stakeholders. But collectively, the goal of the CTC is really to think about how do we expand knowledge development and knowledge utilization in both justice and health settings, and all of the stakeholders and constituents those involved. We have a number of core functions that kind of align with what I just spoke about. Jessica is going to talk about some of the practitioner and stakeholder boards. Tisha's already mentioned that we have a very robust website called JTech that has online courses, webinars, some of the science translation efforts, and all of that is available to the public at large. All you need to do is go to our website, which I will post in the chat box when I'm done, and sign up, and you will get information. As I said, because this we've developed this to really expand knowledge, we do not limit access except for to some of the data, obviously, but we don't limit access, and we want to encourage as many and as broad of audience as possible. So what we get is we get correctional officers who are now taking our courses, or judges who are taking some of the courses, and so that's a very important part. And then another key to the work that we're doing is really workforce development and advancing knowledge about how to do things, so the how, within different types of arenas. And so we've been doing some really interesting work, and this is work the CTC is doing in terms of studies on how to correct misinformation, how to really advance specialty courts that are designed for veterans, how to coach in different settings. And that's just some of the package of tools and products that we have developed, but they're all based upon studies that we have conducted. So I won't have time to go into everything that we've been able to do, but I do want to pinpoint you. So the JCOINCTC.org is the publicly available website. We have information on that website, as Tisha indicated, about the various studies that have been conducted. We have information about webinars. It becomes, if you go across the spectrum of the honeycombs, the website actually holds everything from research to collaboration information, stakeholder engagement, training and outreach, and dissemination. I will point out to you that for those of you who are interested in the cost toolkit that Sean Murphy and our colleagues at Cherish have developed, there is a webinar on Friday, tomorrow at 1 o'clock, that basically gives information about that particular toolkit. So one of the most important things that we have done is really focus our attention on advancing the workforce. And Warren Ferguson and Danielle Rhodes, who lead this core, have developed something called LEAP, which is the Learning Experiences to Advance Practice. And there's two tracks. There's a track for practitioners to really understand, the research and how to facilitate research within their particular settings. And then there's a track for young investigators or people in mid-career that are transitioning and want to work within the criminal legal system to be able to learn new strategies and new techniques. There are 6 courses that we have developed specifically, one on the culture of corrections, another on mixed methods, a very robust series on implementation science that we would encourage a broad spectrum of people. We even got Greg Ahrens, who leads a lot of implementation science efforts to develop this course for us. So, the LEAP track has trained various scholars and investigators across very broad disciplines. We have been very pleased that we've been able to attract scholars and investigators that are minorities, because one of the things we really want to do is build our field. And as we all know, for some people, becoming an NIH researcher or participating in NIH research is not always easy. And so one of the things we've been able to do in LEAP is break through and really begin to develop this new cohort of workforce. So to just give you a sense, here's a background of LEAP investigators. We are very much interested in, expanding the workforce of people who work in the area of research, and particularly for people of various disciplines. And then we also, as I indicated for the scholars group, but I could also show this for the investigator group, we also are very much interested in making sure that we tap into the large domain of people that work within the field. So collectively, the CTC has a public-facing website. We have a lot of rich material on there. Jessica will talk about, how extensive, access is and the different methods of which we push out information as part of our dissemination and implementation efforts. So with that, I'm going to turn it over to my colleague, Jessica Hulsey.
Thanks, Faye. I'm really excited that we get to share with you some more details about the stakeholder engagement that has really been built into the CTC, the Coordination and Translation Center for JCOIN. I sort of co-lead those efforts with my colleague, Joel Johnson, and his team at Task. And we get to share some examples of product development, knowledge translation, and also how we bring stakeholders across various fields to the table, and not just waiting to the end once we have new findings and studies that are coming out, but from the very beginning. Tisha sort of envisioned us bringing and building this collaborative process from the get-go, which is really exciting. In terms of this core within the CTC, really focusing on dissemination efforts and stakeholder engagement, we really talk about 3 primary goals. meaningful engagement. So not tokenized, not checking the box, but really having meaningful and engagement and work with a variety of stakeholders, from individuals with lived experience who have substance use disorders and justice involvement, to criminal justice, to health practitioners, to advocates in the community. We also work on the rapid translation of research findings, but in doing that, it's two kind of relates back to one, to make sure it's tailored to those audiences. So it's the right format and content. And then our overall goal is to really make sure that we're speeding science to solutions. We want to have that knowledge utilization, but awareness, engagement. How do we make sure that we sort of close that gap? I wanted to make sure that there's some time left over for questions, so I'm going to speed through some of this, but please sign up for office hours or reach out to us or visit jcoinctc.org if you'd like more details. But we have 5 key components of our stakeholder engagement framework. We focus on audience identification to make sure that it's beyond sort of the scientists and researchers that we want to engage, but which lanes of the criminal justice system, which lived experience organizations are we bringing to the table. So really focusing on a big tent approach to who can benefit from new knowledge out of JCOIN. We have several components I'll share with you that is sort of made up our framework for stakeholder engagement. Bi-directional communication. It's not us just sending information out to the field, but we want to hear from the field. So we have quarterly feedback loops where our stakeholders tell us what keeps them up at night and what are the top challenges and emerging trends that they're seeing on the ground. And not only do we hear that information, we invite Tisha and Nora and others from NIDA to benefit from that access to this sort of broad view, like I said, that big tent approach to stakeholders. We tailor all of our knowledge translation, which I'll give you some examples. That is a super fun part of this project that my team and we love working on that. Sometimes one audience might really want an explainer video or an animation, and others like a policy brief, and some might want an implementation manual, and others want very simple social media content. So it's great to be able to have the flexibility and the system built in here to tailor that knowledge for such distinct audiences. And then, of course, we track engagement. So I mentioned identify your audience. So these are the priority audiences that we've identified for JCOIN research, right? And so we have everything from justice systems, policymakers, individuals with lived experience, health, and community. And it gives you a sense of how we're trying to expand who can benefit from new information and knowledge that's generated. Our platform, in terms of what is our framework for stakeholder engagement, we have 2 separate boards as well as a larger dissemination network. So on the practitioner side, our board is the individuals, so addiction psychiatrists, physicians, sheriffs, secretaries of state correction systems, individuals who lead advocacy organizations, specialty treatment providers. So these are the on-the-ground practitioners that can provide input and insight to inform JCOIN. But we also have what we call the stakeholder board, which is national associations who represent the memberships that we're sort of prioritizing. So for one example, we might have one specific sheriff that serves on our practitioner board, but then we have the National Sheriff's Association and Major County Sheriff's Association that sits on our association board. And this way we're able to have focused, granular view of what's happening on the ground for practitioners, as well as engagement and that dissemination machine for the national associations who are membership and who have lots of different sheriffs or different physicians or different large networks of individuals with lived experience that they engage. Here's a quick overview. I'm going to we'll make sure that we post this and share this, but this is a quick snapshot of our practitioner board. Again, that on-the-ground viewpoint, and everyone from sort of judges to police chief to medical directors for sort of specialty treatment. So it's really been very helpful information to get input from this group. Now, our stakeholder board composition has 70 association partners right now that are a part of JCOIN. I could not put all 70 logos on one slide because that was a very messy slide. But here's just an example. So from Justice Systems, we'll have Correctional Leaders Association, we have ATOD and AAAP from Health Systems, NACO and the Justice Center representing county and state policymakers, Just Leadership USA, an association of persons affected by addiction for lived experience input. So having all 7 of these associations, they, and our goal from day one is meaningful engagement. So they share with us their challenges or needs on a quarterly basis. We share with them JCOIN findings and new knowledge, new content, and there's this sort of meaningful bi-directional collaboration and communication that happens every month. You can go through this really quickly. Again, that bi-directional piece. We love that both our practitioner board, all of our stakeholder associations, those that work with us, they have postings on their LinkedIn profiles that they are a member of JCOIN, that they are part of this, that they feel like they have ownership and engagement with JCOIN from day one. That really means that they're committed and they want to promote findings. They want to share in our information settings. So it's been really exciting to see so much engagement and how much growth that we've had in the network over the 4 years. So I wanted to just share with you a quick overview, and I'll breeze through the last couple slides because I think I'm over time. But we look at knowledge translation and tailoring knowledge translation a bit differently. So like tier 1, all the PIs and researchers in JCOIN are publishing in high impact journals and making sure that we can get that information out for all of you researchers and our scientific audience. But the content and how our stakeholders take in new information isn't typically from journals. So we have a range of things from a translation for social media, a layperson summary or a short summary. We do tailored layperson summaries for the organization. So it sort of builds in as more tailored to whichever priority audience we really want to focus on. We do video explainers and animations and cartoons, e-courses. We love putting our e-courses together. And then there's also technical assistance. So there's actually 13 different levels of this, but that was kind of a messy slide too. But this gives you a snapshot of just some of the different products that we've developed. And these are all examples from JCOIN studies that have been published. And one other example just of a video explainer. So this isn't us translating JCOIN science. This was sort of a precursor when we're trying to explain the why and sort of till the soil to make way for more JCOIN research. So we have some really important pieces that have come out of JCOIN, the sort of head-to-head studies about long-acting injectable formulations versus oral formulations. In a New York study, the reduction in recidivism for MOUD. So this video explainer is sort of getting our audiences ready for JCOIN findings. So we combine 2 studies, the Binswanger study and the Degenhardt study, talking about the risk of overdose at release from jail, and then also the efficacy of medications for opioid use disorder. So it kind of combines a problem and a solution into one video explainer. We identified all of our audience categories from criminal justice to individuals with lived experience to have access to this. We developed the product, which is about a 2.5-minute video explainer. Went back and forth with all of our stakeholders to really test that out. And they chose everything from giving us feedback on imagery to the voiceover artist and the script and you name it. Then we partnered with CLA, the Justice Center, Jail USA, and the American Jail Association to disseminate this video explainer and had multi-channel dissemination. Some put it out in newsletters, their websites, their social media channels. So when you partner with your stakeholders who can help you improve your content, to have more utilization of our translation and our research translations, we can really see that sort of follow through with how much engagement we have of the content. We've done the same thing with making e-courses for our stakeholders. And as of last month, we've had nearly 3,000 stakeholders complete, not register, but complete courses that sort of are focused on JCOIN findings, everything from fentanyl risks to medications for addiction treatment to stigma, and they are customized for each one of our stakeholders, so they feel like wow, I just did a course with NIDA and I get to share this with my entire network. So lots more knowledge. Lots of knowledge and awareness of JCOIN and its importance, and then lots of stakeholders who have new information that they now hold as a result. So here's some of our, we say that we track engagement. We have over 12,000 stakeholders we've engaged. Here's a chart on sort of our top 5 stakeholder lanes that we've worked with, and then looking more granularly at who's been a part of our events or our webinars, surveys, the courses that we've taken or put out, and also who's serving on our boards. This is a breakdown of those 12,000 stakeholders by lane from our justice system participants. So we have high engagement by court officials and court leaders, judicial leaders, our health system, lots of treatment providers and addiction specialty providers, community services, family services, followed by reentry and community services are sort of the leading audiences there. And then on the state and local government, we've had a lot of engagement by state policymakers. And here, outside of just that individual engagement, we've had over 285,000 engagements with JCOIN information since we started this stakeholder work. So here's a little bit of the numbers on the emails that we've delivered, the webinars and events that we have produced and put out to our stakeholders as part of JCOIN, our social media engagement, and our website views. So thank you so much for allowing us some time to share with you the stakeholder engagement components of JCOIN. It's really an honor to be able to work with Tisha and Faye and this amazing team, but to get information out to the field, to people with lived experience, to those that work in criminal justice or health or advocacy, to make sure that they're benefiting and building in this new knowledge into their work every day is really phenomenal. And I'll hand it back to Lindsay.
Wonderful. Thank you so much.
Yeah.
We can go to the next slide. I do think we have a couple of questions in the chat, but first I wanted to say thank you so much to our JCOIN presenters. And I think Elizabeth D'Amico said it right in the chat. Really wonderful to see how many ways that you're able to disseminate to communities. Thank you so much for sharing this important case study, Tisha, Faye, and Jessica. Jess, we only have time for one question, and it is directed to you. But I want to remind folks that we will be hosting office hours in a few weeks. So if you have more questions about research dissemination strategies and want to engage with us further, please come to office hours. The question is, true engagement means that you will be routinely surprised at how stakeholders perceive something differently than you expect. Jess Holsey, if you could share an example of something that surprised you the most in your JCOIN work or your new work with Heal Connections, please share it with us.
Sure, that's a great question, Jenny. A couple of things that were sort of surprises, or I just think sort of meaningful input from stakeholders. We were sharing some information about so new studies or new data on medications for opioid use disorder and jail settings and prison settings. And we had some of our stakeholders really pause and share with us in a really meaningful way the challenges and difficulties they were experiencing with staffing shortages. And it was interesting. They were like, we really want to do this, but we're at 52% staffing capacity. So this is affecting our programming, our ability to provide medications to all of our folks that are in custody that might need it. So I think there's some real life challenges that can be shared. I think some of the other surprises, one example is doing a focus group with all the state prison directors, secretaries or directors of prisons. And it was interesting. Sometimes we can perceive that there's resistance or the need for a lot of education for those in leadership for corrections. And they were just very, very adamant. We would love to do this, but the problem is, how do I convince my governor, my legislature? How do I bring other people? So it was a surprise in many ways because the barriers were not in their own knowledge or willingness, but in some of the political systems that they need to run through. So I think it was a little bit of a surprise, but again, helpful in us being able to respond to that need and hopefully give them some tools and resources to do that work. So there's just a few things off the top of my head.
Wonderful. Thank you. And I know we have some more questions in the chat. So please join us for office hours for a deeper exploration. If we can repost that link in the chat, I think it's not working for some folks, but you can also click on your follow-up email and the link will be properly pasted so that you can follow it to attend office hours. Our next sharing session, we have a two-part series scheduled for July and August on inclusive language, imagery, and storytelling for addiction and pain researchers. We hope that you will join us. The registration links will come soon. We would love for you to take our meeting evaluation survey. That will be posted in the chat now so that you can fill it out before you leave the meeting. It should only take you 2 minutes. We'd love for your help designing and contributing to and improving our programming. So please complete this meeting evaluation survey so that we can gain your insights. After today's meeting, here is what you can expect. You can expect to receive some information from us so that you can register for office hours for a deeper discussion since we didn't get to much Q&A today. You will also receive a registration link to the upcoming sharing session that I mentioned. And if you don't have time to complete the evaluation survey that's now posted in the chat, you will receive that via email too. And we'd love to learn from you. If you have ideas for presentation topics, please paste them into the evaluation survey. We have a question for that if you have a case study that you'd like to share, like our JCOIN colleagues did today. So we will plan to end on time. I just wanted to thank everyone for their attendance and a special thank you to our JCOIN presenters for sharing their work with us. We hope to see you next time on our next sharing session in July. Thank you.